Clinical manifestations of correctation of aorta. Clinical manifestations. That means कि what are the signs and symptoms of correctation of aorta. जो इसके clinical features होते हैं, correctation of aorta के जो clinical features होते हैं, that depends upon the type of defect. Depends upon the type of defect. And usually become evident after the closure of PDA. जो इसकी clinical features है, that depends upon the type of defect and usually become evident after the closure of PDA, patent ductus arteriosus. Usually जो correctation of aorta है, it may exist as preductal or postductal, so that is why it becomes evident after the closure of PDA. Now you will see the sign and symptoms. In neonates, firstly in neonates, जिसमें presenting features are that are severe CCF, poor perfusion, tachypnea, absent femoral pulse. In neonates, जिसमें features होते हैं that is severe CCF, that means congestive cardiac failure, poor perfusion, that means there is inadequate or decreased atrial blood flow to the extremities. Tachypnea means there is abnormal fast breathing. Also, when there is decreased blood flow to the extremities, that causes absent flow femoral pulses. इसकी वजह से femoral pulses भी absent होते हैं in neonates में. But in older children जो होते हैं, it may be asymptomatic. In older children, it may be asymptomatic with normal growth and development. जो older children होते हैं, उनमें जो clinical features है that are usually absent, जिसको हम बोलते हैं that may be asymptomatic with normal growth and development. But overgrowth of upper limbs and hypertension, but overgrowth of upper limbs and hypertension may also present. Usually in upper extremities. May present. And there may be absent of weak femoral pulse. In older children, there are no signs and symptoms that are having normal growth and development. बट इसमें क्या हो जाता है, जो अपर लिम्स है उनमें ओवर ग्रोथ होती है. ऑल्सो hypertension in the upper extremities, that is with absent of weak femoral pulse. This is in older children. Other manifestations also include other manifestations other manifestations include fatigue, cramps, intermittent claudication, headache, weakness, exertional dyspnea. इसमें अदर फीचर्स भी होती है, अदर साइन एंड सिम्टम्स होते हैं. दैट इंक्लूड्स फैटिग, दैट मीन्स देयर इज टायर्डनेस, patient gets tired, patient is having cramps. Intermittent claudication, intermittent claudication हम किसको बोलते हैं? This is a form of limping, this is the form of limping. legs में क्या हो सकती है? there is aching, pain हो सकती है, cramping या crampy हम बोलते हैं, tired, also burning pain in legs, that is known as the claudication. यूजुअली ये किसकी वजह से होती है? ये जो claudication होती है, इंटरमिटेंट claudication, ये हो जाती है ड्यू टू द पोर सर्कुलेशन इन द लेग्स में, क्योंकि वहाँ पे ब्लड सर्कुलेशन प्रॉपरली नहीं होती है, जिसकी वजह से इनमें एकिंग होती है, क्रैम्पिंग होती है, टायर्डनेस होती है, बर्निंग पेन होती है इन लेग्स में. यूजुअली जो ये claudication है, ये होती है एट द टाइम ऑफ वॉकिंग, व्हेन द चाइल्ड वॉक्स एंड गोज अवे at rest. Also, the child complains of headache, weakness, and exertional dyspnea. That means that at the time of exertion, the child is having difficult breathing. Difficult breathing at the time of exertion, or there is shortness of breath at the time of exertion. These are the signs and symptoms of correctation of aorta. Now the diagnosis. How the disease is diagnosed. Diagnosis जो है, that is confirmed by chest X-ray. Chest X-ray is done to confirm the correction of aorta. Barium swallow, ECG, angiocardiography, and also cardiac catheterization. इन्वेस्टिगेशन इज डन बाय चेस्ट एक्सरे, बेरियम स्वेलो, ईसीजी से पता चल सकता है. एंजियोकार्डियोग्राफी इज डन टू डायग्नोज द करेक्टेशन ऑफ aorta, and also cardiac catheterization is done to diagnose the correction of aorta. But in barium swallow, it demonstrates E sign. Barium swallow जो है, it demonstrates E sign. जो फर्स्ट आर्च ऑफ ई होता है, that is due to dilatation of aorta. जो इसमें फर्स्ट आर्च ऑफ ई होता है, that is due to dilatation of dilatation of aorta before correctation. Before correctation जो इसमें सेकंड होता है that is due to post stenotic dilatation. Second one is due to post stenotic dilatation. Post stenotic dilatation and middle due to first arch of sine, second arch of sine and middle arch of sine. That is due to correctation itself. By these, correctation of aorta is diagnosed. After diagnosis, management is started. Management of correctation of aorta. इसमें हम मेडिकल मैनेजमेंट करते हैं. जो इसका मेडिकल मैनेजमेंट है, जो इसमें मेडिकल मैनेजमेंट है, that is done with prostaglandin E1 infusion. मेडिकल मैनेजमेंट में क्या दिया जाता है? प्रोस्टाग्लैंडिन E1 infusion, that means IVA दिया जाता है. Also antibiotics. And prevention and treatment of complication is the management, medical management. This is the medical management. Medical management में क्या किया जाता है? Prostaglandin E1 infusion, antibiotics and treatment of complications किया जाता है medical management. Surgical management, surgical intervention जो होता है, जो इसमें surgical intervention होता है, that is planned in 3 to 5 years after management of systemic hypertension. After management of systemic hypertension and other associated problems. Firstly, medical management किससे किया जाता है? प्रोस्टाग्लैंडिन E1 infusion, एंटीबायोटिक से, और इसमें मेडिकल मैनेजमेंट में ट्रीट किए जाते जो इसमें अदर कॉम्प्लिकेशंस होते हैं. जो इसमें सर्जिकल मैनेजमेंट होता है, सर्जिकल इंटरवेंशन जो है वो प्लान किया जाता है 3 to 5 years of age में, आफ्टर मैनेजमेंट ऑफ सिस्टमिक हाइपरटेंशन एंड अदर एसोसिएटेड प्रॉब्लम्स. इसमें हम क्या करते हैं? सर्जिकल मैनेजमेंट, corrective surgery is done. इसमें corrective surgery is done and that is anastomosis. That means कि जो subclavian flap होता है that is rapier and dacron patch rapier जो है उसी को प्रेफर किया जाता है. Subclavian flap rapier, this is the corrective surgery. Subclavian flap rapier and dacron patch rapier is preferred. This is preferred. That means कि हम इसमें क्या करते हैं? Corrective surgery performed a resection of constricted area and plus end-to-end anastomosis is done. Usually किसमें? subclavian flap rapier and dacron patch rapier. Chances जो होते हैं इसमें development of correctation in later life that are reduced. Also अगर CCF डेवलप होगा, कंजेस्टिव कार्डियक फेलियर जो है वो डेवलप होगा इन नियोनेटल पीरियड में, या अर्ली इन्फेंसी में, कंजेस्टिव कार्डियक फेलियर जो है डेवलप होगा नियोनेटल पीरियड में या अर्ली इन्फेंसी में, तो इसकी वजह से क्या हो सकता है? देयर इज डेथ, देयर इज डेथ। अगर कंजेस्टिव कार्डियक फेलियर नहीं हो गया तो जो ये चाइल्ड है इट मे डू वेल विदाउट सर्जरी। Throughout the childhood and adolescence. This is the management of correction of aorta, and this completes the topic.